All right, so there were several students that weren't able to make the class today for various reasons, so I decided to record some of what we had done during the skills workshop. So this will be a short video, kind of an abbreviated version. Um, Basically, this presentation starts out with diagnostic imaging. These are the kinds of things that you would do if you're in a GI specialty. So you can look through that. And then we also looked basically at x-rays. So when you have free air in the abdomen, you can get what's called a double wall sign. Well, basically there's air inside and outside the intestine, as I explained in class. Normally, the border between the intestine, which is kind of a lucency on an x-ray, and the outside environment is not so distinct. But in this case, because you can see the wall of the intestine, it's called a double wall sign. You'll see in this x-ray that the bowel doesn't have that distinct line in it. So that's the double wall sign. And then down low, there's the diaphragm, which is you can see free air under the gastric side and the on the liver side, which shows that free air in the abdomen. Moving on, we reviewed small bowel obstruction, where you can see the valvulae conventus, which is the lines that go through, almost like a stacked coin kind of look. And that's typical of a small bowel obstruction. On the right, you see an ileus, which is where there's loss of peristalsis for, in this case, surgery or otherwise. Similar look on an x-ray to a small bowel obstruction, but a little bit different in approach and treatment. And of course, if I saw either of these things, I would not be able to tell where the obstruction was, and you'd end up just doing a CT for these two things. So then there's the large bowel obstruction, which you can see the haustra and you can see the intestine traversing through. Obviously different from the small bowel obstruction in appearance. Right at the bottom, you don't see that the gas enters the rectum and stops there, so that you end up getting an idea that the obstruction in this case is probably in the rectum, because of the gas basically traversing through and then stopping there. Here's a sigmoid volvulus, which we talked about the coffee bean sign. Basically, a volvulus meaning that the sigmoid colon has twisted, which has caused an obstruction, which can lead to perforation in addition to ending up with ischemic changes that can also be present. And that's that x-ray. And then this image shows thumbprinting, which is basically inflammation in the bowel wall, which comes from ulcerative colitis or Crohn's disease. And you'll get a thumbprint type look to the wall of the colon as it traverses through the abdomen. All right, the second part of the presentation was going through a couple images on an app called Explain Everything. Which is kind of a fun way to look at things. If I can get this thing to match up right. So, in this particular x-ray, this is a barium swallow, and you see the esophagus outlined with the barium there, and then it narrows at this point, and that's called a bird beak sign. Basically, this is a barium swallow image of what achalasia would look like, which is basically loss of peristalsis to the abdomen. Next, we'll look at a regular x-ray of the abdomen here, where you see the gastric bubble, and then you see just normal stool. Quite different from what we were seeing with the other images with the bowel obstruction. So that's a normal looking abdomen. This image here is basically a normal liver ultrasound, and it shows the border of the liver on the bottom side. And of course you're shooting through a plane with the ultrasound device. So there was that. And then next we did image of a CAT scan. Kind of went top to bottom through a CAT scan to see how this would look. And we went top to bottom through this CAT scan, looking at what we can find here. So let's start at the top. Here you see heart, and you see aorta, and of course lung fields. And then as we went through the abdominal CT, you can see major structures as the liver. There's the aorta again, there's a kidney, this is spleen, this is stomach. And you can see that as well. Let's keep moving. So you could potentially use this to quiz yourself. There's pancreas, which is right here. And then the other kidneys there. And as we move down through the abdomen, you can see gallbladder here. And of course, this person has had oral contrast, so all of the small bowel actually appears white. You can see transverse colon here. It doesn't have that same bright white appearance. And we'll go down towards the rectum here, and you can see the bladder come into view as well in this area. So important to note as we go back up, pay attention to where the aorta is right here. That's the vena cava. And then what we're going to do is switch to the other view, which gives us a good shot from a coronal view. And we can move through, seeing psoas muscle here and here. And we'll move through, and you can see the aorta as it splits, and there's inferior vena cava. And then you can go through and you see the mesentery coming up this way. Gallbladder again there. And that's view of a coronal shot through an abdominal CT. So we have a different CT scan. This person has had intravenous contrast, and you see the heart there. See the aortic arch come across there, which is you have aorta here and here, and then it joins in the arch here and here. And then what we're going to do is we're going to track this aorta down through the abdomen, and then what you do is you see it enlarge significantly right about here, and this person actually has an aortic aneurysm, and in this case it ruptured and you have blood collecting in the extravascular space there. If we switch over to the sagittal view here, you can see the same thing where the aorta comes down and enters into this large space here, constituting the aneurysm. That's basically what we did for the workshop. Hope that helped kind of see at least a brief orientation to what we did. If you have any questions, let us know.